In this video, we're going to talk about how to differentiate the various causes of hip pain. We get questions all the time about this. We get people reaching out asking us if we can help them with their hip pain. But the first step for you or for us as a practitioner is to understand where is it coming from exactly so we can actually treat it properly. My name is Dr. Todd Pickman. I'm the clinic director of Gonstead Spine and Wellness here in Meridian, Idaho. Let's dive into it. So let's go to the second thing here. Is there a muscular issue that is causing your hip pain? Very commonly, we'll see patients say that they have hip pain, and they're not really talking about their hip joint like I just covered. They're talking about more in like the buttocks region, deep into their glute, deep into the back part of the hip, almost by the sacroiliac joint area, which I'm going to cover in some detail here in a minute. But in this diagram, you'll see on the right side of the diagram, there's all these deep muscles that are around a commonly recognized muscle, the piriformis. That is that little triangular muscle that attaches down from the sacrum and goes to the back of that upper leg bone. And these are external rotators. So they cause the leg to externally rotate outwards, but they also cause the leg to extend. So like when you walk and you propel yourself forward, your femur, your upper leg bone, bends back behind you. That's hip extension. And the main hip extensor is your glute maximus, the largest muscle in the whole body. The glute maximus is the prime mover, meaning it is the main muscle that's supposed to be shooting your leg backwards to propel you forward. However, if your glute max is not strong, not engaged, not activated, and you're not using it when you walk or run, then a lot of times those deep hip external rotators, which are not really great hip extensors, they will have to be taxed and they'll take over in the activity of hip extension. So the glute max is not doing its job, and all these little deep external hip rotators, they start to take over and they get very tired and fatigued and painful. And then when someone says, oh, I have this deep hip pain, and someone identifies it's coming from your piriformis muscle and all these deep hip external rotators, their solution oftentimes is dig in that area with a foam roller and a double lacrosse ball and just dig until the cows come home. Well, that might be the thing that initially gets you out of pain. But if you understand this relationship, you'll see that the prime mover is not doing its job. And that's why all these overactive synergists, meaning they do a similar joint action, the hip extension, but they are not the prime muscle that's supposed to be delivering that action, so they fatigue and wear out prematurely. So the way to fix this is you have to activate the glutes properly. That's getting to the root cause of this. That's one of the solutions, is glute activation. We go to the front of the hip now. This is another muscular component that patients can talk about hip pain, and they point to the front of the hip, but they actually point kind of to the upper thigh area, and that is what is called the hip flexor region. And so on the left of the screen, we have some of those deeper muscles that attach at the lumbar spine on the inside of the pelvic bone. Those are the hip flexors, like the iliopsoas and the iliacus. Those are very deep. Maybe sometimes you'll see videos where people are digging into the abdomen trying to work on that. That can be caused from overactivity or even weakness of those muscles, or abnormal postures for prolonged periods, such as sitting throughout the day. When you sit and your leg is up at a 90-degree angle compared to your torso, like I'm sitting right now, but you can't see my legs under the table, that will put those muscles in a shortened position. And that whole issue there is called adaptive shortening. If they're in a shortened position for prolonged periods, those muscles have a tendency to stay short. And then when you get up and walk and move around, it puts a stretch on them and can create pain. You have pain in that area. Another issue though in those hip flexors is that they can be weak. So believe it or not, when muscles become weak, they tighten as a compensatory mechanism to try to create some force going through the muscle in stiffness and tightness because they lack strength. So one of the solutions is strengthening the muscles, not always just trying to stretch them and elongate them and tone them down. So in this case, in this diagram, we're showing some hip flexors that again originate in the spine, in the pelvis. And then as we go lower down, we'll see like the rectus femoris and the sartorius. Those are ones that actually cross the hip joint. those muscles can create pain as well, because those muscles are also categorized as a hip flexor. So it falls into the category of everything that I was just explaining, that whole mechanism of sitting or being weak in that ability to bring the knee up towards the chest. And then there's something called lower crossed syndrome. This ties into what I'm talking about with tight hip flexors. This is this crisscross pattern of having weak abdominals and weak glutes. And then if you flip that crisscross almost like it's an X, then you have tight hypertonic lower back musculature, and then you have tight hypertonic hip flexors. This pattern is a pattern that can happen with abnormal positions, inactivity patterns as far as not working the muscles in a functional manner, whether you're very active in a workout routine or you don't work out at all. It falls on both crowds. Some of our patients that have this are athletes and they work out in the gym, and some are couch potatoes and they also have this problem. So it's not just about, are you strong and do you exercise, but do you have good tone and balance and activation of the muscles? So lower cross syndrome can also be one of those things that ties into hip pain. It's important to understand. And then this concept of joint centration. Okay, now this rounds out everything that we're talking about and kind of ties back into actual ball and socket hip pain. What centers that ball in the socket? And it's the muscles in the front of the thigh, the hip flexors, and the muscles in the back, which are the hip extensors, like the glute maximus and those deep external rotators. If there's a good balance between the muscles in the front and the back, the hip sits right in the center of the joint. In the diagram, you can see that circular white ball, that is the head of the femur. It can shift forward. So like on the right side, it says hip is decentrated. So that muscle imbalance allows the head of the femur to shift forward. And there's protocols that we teach our patients on how to start to, one, pull that hip back, and then two, tone down the muscles in the hip flexor in the front, and then three, activate the posterior musculature in the back of the hip, and then do a functional exercise to repattern that movement for long-term stay put value. So that's one of the protocols that we would do when we find this muscular issue. Okay, so there you have it. That is a breakdown of the different causes of hip pain. We covered almost everything out there. There's probably a couple others that I didn't cover, but if you have any sort of hip pain, or you know anyone that has hip pain, or if anything that you watched in these slides intrigues you as far as just wanting to get a full comprehensive spine workup, you can reach out to us. Our clinic's Gonstead Spine and Wellness. Our contact information will be below. And when it comes to the health of you and your family, results matter most. Thank you for watching. Make sure you subscribe, like, and comment. We appreciate you watching, and we'll see you on the next video. Video presentation by Meridian Gonstead Spine and Wellness of Meridian, Idaho. Our practice is dedicated to people suffering from neck pain, low back pain, tension headaches, migraine headaches, herniated discs, and leg pain such as sciatic. We have treatment protocols for musculoskeletal aches and pains, joint pain and dysfunction, and whiplash injury. Gonstead Spine Wellness offers a distinctive chiropractic experience. It is the only office in Idaho with digital motion x-ray technology. And this advanced imaging tool, combined with the Gonstead spinal analysis and necessary radiographs, enables precise identification of spinal issues. We provide safe and effective Gonstead adjustments, corrective care through chiropractic biophysics to enhance and sustain proper posture, and a 12-week transformation program. This program includes access to a comprehensive video exercise library for ongoing home support, ensuring long-term health and wellness. Call us at 208-888-6077, where results matter most.